Hello, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, and I'm here to answer some questions about cat spaying and neutering and some of the common questions that you might have for your veterinarian, and I'm going to take some of those questions today.
So, Dr. Lucas, what's cat neutering, straight up?
Cat neutering is when we actually remove the testicles of a cat. Sometimes we also field questions about cat neutering can also be a spay for a girl or an ovariohysterectomy. We're removing the ovaries and the uterus of a female cat.
How does spaying and neutering impact the health and well-being of a cat?
So we know a cat that is left intact, either a boy or a girl cat, can develop some really unsavory behavioral issues. So male cats like to urinate on surfaces in your house if they're left intact. That's probably the number one behavioral issue that we'll deal with intact males. We also know that females will go through estrus cycle through the sort of winter, early springtime, and they will become quite amorous and create a lot of just annoying behaviors that happen from females being intact. So those are some of the most common concerns that pet parents will have with intact males and females.
How soon should you bring your cat in to see a veterinarian to get them spayed or neutered?
So the average sort of age that most cats are spayed and neutered is around 6 months of age. Certainly, we know through the American Veterinary Medical Association, cats can actually be spayed or neutered as young as 8 weeks of age, like at shelters, and that has been deemed completely safe. But the average sort of age that most cats are spayed and neutered is around 6 months of age.
How will spaying or neutering affect the overall behavior?
So obviously, if it's an intact male and they've developed some spraying behaviors, by neutering them, that should make a big improvement in that behavior. Spaying a female will also stop that amorous estrus cycles that they're also having. Cats that are intact males also are most vulnerable for fighting each other for territory and mating rights. They also are the most commonly infected with feline leukemia and FIV. So some of those infectious diseases are really more predominant in the intact male. So preventing disease can also happen with having a spay or a neuter done.
How should I care for my cat before and after a spay or neutering surgery?
So caring for them before, we here at Blue Oasis do recommend that your cat is on maybe some relaxation or calming medication before they come in for their procedure. We also, when we send you home, we're going to recommend that they, if they're an indoor-outdoor cat, of course, we're going to recommend that they stay inside. We want them to be safe and sheltered, at least for the first week after they've had their procedure. We're also going to have you monitor them every day, make sure they're eating okay, giving them their pain medication appropriately, and making sure that we're having you observe that incision site, either in the girl on their belly or around the boys around their bottoms. But ultimately, there's not a lot of care that we're going to have you do specifically for those surgical sites. Mostly it's going to be just making sure they're in good pain management and having good, safe place for them to recover, as they will be probably under some medications at that time. So if you have some specific questions or concerns about your cat and when it should be spayed or neutered, we are happy to help answer some of those questions. Please give us a call here at Blue Oasis Pet Hospital.